Hello, I'm Dr. Paul Christo, Associate Professor in Academic Pain Medicine. I also host Aches and Gains radio talk show on SiriusXM. We're here to explore alternative treatments for acute nonspecific low back pain. Although pharmacologic management can often provide prompt relief to patients suffering with back pain, there are other options. Opioid overdose is a growing epidemic. Learning to detect and prevent the unnecessary use and abuse of opioids and improving the way we prescribe them can greatly reduce the number of patients who use and misuse these medications. The American College of Physicians offers guidelines which strongly suggest the use of alternative therapies, including acupuncture, thermal therapy, massage, physical therapy, and chiropractic treatment as first-line options. These alternatives may allow millions of Americans to maintain an elevated quality of life while avoiding the risk of addiction. One of the many first-line alternatives to pharmacological treatment is acupuncture. For over 2,500 years, acupuncture has been used to maintain wellness and treat pain. This time-honored therapy uses fine needles inserted into selected points on the skin to release blockages and restore flow. This reduces inflammation and relieves pain. Here to answer questions about the practical use of acupuncture for treating low back pain is Laura Alves. You know, acupuncture has been used as a Chinese therapy for 2,500 years to achieve wellness and to treat pain. And there are high-quality scientific studies that have shown the value of acupuncture for conditions like migraine headache, fibromyalgia, low back pain. And with respect to low back pain, have you found acupuncture useful for treating acute low back pain?
Low back pain is one of the main reasons a lot of patients come to see me, and we've had wonderful results with people coming in with chronic or acute symptoms, pain radiating up and down their back, and depends on the patient, but after a few treatments, many find relief.
Is there a difference between patients who have acute low back pain and chronic low back pain with respect to the treatment that you perform?
Absolutely. I think in general, the acute pain is sometimes easier to treat, or patients can find relief a bit faster. Whereas for chronic, since it took a long time to create this pain, the pain alleviation can take a lot longer to dissipate from a patient. In my opinion, I really think that anyone can benefit from acupuncture, whether they want to increase their quality of sleep, they want to have a better body balance, and then there's people that might have chronic symptoms, autoimmune disorders, and I think really everyone can benefit.
Have you found certain types of pain more effectively treated with acupuncture than others, though?
I think in general, if I'm thinking about the protocols that we use to treat pain and the kind of focus that we use to treat the patient, it really depends on the patient's willingness to also participate in their healing. So if they're willing to change diet, or if they're willing to perhaps take Chinese herbs as well, we find that the results can be a lot better.
Talk to us now about the mechanisms of how acupuncture reduces pain.
One of the ways is that it creates a local anti-inflammatory effect. It can release endorphins, the body's natural feel-good hormones. It can also release dynorphins, the natural body's painkillers. And a lot of these can help to uplift mood. It can help them just feel better so that they can kind of take more of an active role in their own care.
Talk to us now about the actual technique of acupuncture. Where do you place the needles, and how do you know where to place them?
For us, and for many people that might be squeamish when it comes to needles, your acupuncturist can use distraction techniques so that any kind of discomfort can be avoided. We use special acupoints throughout the body, and these are located on channels and pathways that run all up and down the body in a three-dimensional space, deeper, more superficial. And these unique points, in conjunction with the acupuncture needle placed precisely on this point, can activate the body's ability to heal. It's almost like the acupuncture needle acts as an antenna, calling the body's resources to help out a particular area that needs help.
Now, are these acupoints called the meridians?
The points are actually located on the meridians, and the meridians are what are running throughout the body up and down according to a particular organ system.
Okay, and what are the meridians actually?
The meridians might be considered pathways. They're considered channels throughout the body, and they're channels where chi or life energy might flow. They're channels where the yin fluids or body fluids, blood flows as well. And when these channels may be obstructed, that's what in our medicine can cause pain.
Can patients who have shooting leg pain, that is radicular pain, benefit as much from acupuncture as, say, patients who have just low back pain, axial lumbar pain?
I believe they can, because the channel does run down the leg. There are several actually that run down the leg. So if we activate one of the points and kind of hit the right sweet spot, it can actually help the nerve endings and the inflammation that is causing the pain, thereby kind of fixing everything in one shot.
I'm also intrigued by auricular acupuncture, and that is stimulating the auricular branch of the vagus nerve. How does that work, and when do you use that technique?
In acupuncture, the ear is considered a microcosm for the body. So a wide array can really be treated just by treating the ear. It's pretty extraordinary. So I can treat anything from low back pain to digestive issues to stress and emotional disorders, even allergies in the ear.
Well, so Laura, when would you choose to use the ear, though, as opposed to other points on the body?
If a patient were pressed for time or just did not want to get the systemic or the body acupuncture because maybe it's a winter day and they're clothed and they don't have the time to disrobe, or uncomfortable. If they're uncomfortable with disrobing, then we just stick to the ear acupuncture.
And Laura, how would you persuade a primary care physician to recommend acupuncture over opioids?
So pharmacological management is definitely one way to manage pain, but for someone who perhaps has a family history of addiction or might be prone to dependence on opioids or really any kind of substance, acupuncture is really a wonderful way to get them treated and healed, have some alleviation of pain without this risk. There's no risk of dependence through acupuncture because licensed professionals have to give the treatment, but also it releases the own body's endorphins as opposed to kind of an external medication.
And by the way, isn't acupuncture also used to help treat opioid dependence or addiction?
There's a whole protocol actually that we use in the ear, referred to as the NADA protocol, that I've used for people that wanted to help quit smoking or dependence on other substances.
And what have you found?
They've found it quite effective. I've actually used it myself to quit smoking, and for me it changed the flavor of the cigarette, so I just didn't find it as enjoyable, and shortly thereafter I quit. For many of my patients, they found similar experiences, or they just didn't have the craving as intensely as they did before. So slowly, it's not an immediate process, but slowly they did find less craving, less kind of pull toward that substance.
The benefits of acupuncture are cumulative. Patients should give acupuncture about 10 sessions in order to evaluate effectiveness, and may often need concurrent use of medications or nerve blocks as part of a comprehensive treatment program. Acupuncture is one of many options we have available, and thermal therapy is another. Most people experience back pain at one point in their lives. In 2010, the number of diagnosed cases reached about 83 million. Although the American College of Physicians guidelines recommend non-invasive, non-pharmacologic methods, it seems that patients are still using opioid therapy. For instance, a large randomized study of over 26,000 patients with low back pain showed that 61% received a course of opioids and 19% were long-term users. As healthcare professionals, our primary goal is to provide effective and efficient care to our patients while keeping in mind the long-term impact of our therapies. A simple and effective first-line alternative to pharmacologic treatment is thermal therapy. This is an inexpensive method and easily applied by practitioners and patients alike. Amber Bloom is here today to explain the benefits of using thermal therapy as a first-line option. Thermal therapy can be used to reduce pain. A lot of patients that I have use different types of thermal therapy. Can you describe for us what that is?
Well, by thermal therapy, they usually mean hot, heat or cold. So that could consist of an ice pack or a hot pack. And hot packs could be what we use in the PT clinic, in a hydrocollator. Moist heat is usually typically more comfortable for patients, especially those in acute pain. Or you could just even use something as simple as a regular hot pack that you have at home that you plug in, one of those old-fashioned ones.
What about heating pads? Are those effective too?
Yeah, they're effective. Heat increases blood flow and helps kind of bring in the good cells and get rid of the bad cells. So we do encourage that.
When you recommend heat therapy for patients at home, what do you recommend and for how long per day?
It depends on what they have access to. So if they have a heating pad, I say leave it on 20 minutes. Make sure that you're still awake so you don't burn yourself. There are stick-on hot packs that last up to 8 hours, and you're not supposed to sleep with them. However, if you don't have any sensory issues, no diabetes, anything like that, and you try it out while you're awake, you probably could be okay sleeping with them. If you wake up with morning stiffness, that tends to help.
How about heat wrap therapy? What does that consist of?
Heat wrap therapy, we're talking about the stick-on heating pads that you can leave on for 8 to 12 hours. I think they're very effective. I actually have a patient right now who is on a bike ride who is using one as we speak. So
Wow.
I think they're pretty effective in keeping the joints a little bit looser, the muscles getting more blood flow, and just overall it feels good.
Fundamental knowledge about non-pharmacologic methods of treating low back pain, like heat therapy, should be a focus for all healthcare providers. This will help direct attention away from opioids as a first-line therapy. Next, we'll explore the option of massage therapy in the first-line setting. Despite the recommended guidelines, medical use of opioids has risen 1,448% since 1996. During the same period, opioid misuse increased by 4,680%. There are comparatively low risks associated with the recommended non-invasive treatments, yet among general practitioners, the readiness to implement these recommendations is very low. We can do better. Through awareness and education, we can offer relief for low back pain without risking abuse or addiction. We can also learn to detect risk factors that may lead to opioid overdose. In some cases, pharmacological treatment may be necessary, but most acute and non-acute back pain resolves on its own. Instead of pharmacological therapies, practitioners should consider massage therapy for symptom reduction. I'm joined by Shay Davies. Do you find that massage therapy is useful for acute low back pain as well as chronic low back pain?
It's definitely, in the acute form, it would be less working on the muscles directly and more just kind of trying to ease the tension around the muscles. But it is useful for both, especially chronic. It's a little bit more helpful in that way, just to keep the muscles trained to where they need to be.
What's the mechanism of action? I mean, how does massage therapy work to reduce pain?
Well, it works by flushing out lactic acid in the muscles. So you're just, similarly to a workout when you're sore afterwards, you just want to get the blood flow into the muscles, and tension is oftentimes the muscles are not oxygenated by blood. They've just gotten a little stuck on top of each other. So it works to take adhesions out and get all sorts of blood flow and oxygen back into them.
I've also read that it shifts the body from a sympathetic state to a parasympathetic state.
Yes, that is probably one of the most important factors of massage is, just taking us from the fight or flight mentality to the rest and digest mode. And that's why I was saying in terms of chronic pain and, in acute pain, you're more working on just easing the rest of the body so it doesn't become like a domino effect of tension and pain.
Should it be considered as a first-line therapy for low back pain?
Absolutely, massage therapy should be a first-line therapy for lower back pain. There's a lot of healing that can be done just by getting blood flow back into the muscles. If it's an acute situation, because it's an inflammatory situation, you don't necessarily want to get blood in there, but especially for chronic lower back pain, it's really helpful for relaxing the muscles around that area and kind of retraining them to hold the body the way it's meant to be.
Is there a certain type of assessment that you perform on all patients?
The assessment that I do on all patients is I just ask them what they want to work on, and a history of injuries, history of like chronic tension points, and then what type of pressure generally works for them.
Can you describe the different types of massage therapy? For example, therapeutic massage versus rehabilitation massage versus relaxation massage.
The different types of therapy are all part of the same family with a little bit different end goal results. So So therapeutic massage may also be described as Swedish massage, and that's meant to, once again, get blood flow back into the muscles, work on the parasympathetic nervous system, work on resting, digesting, and just relaxing the body and just letting it do its own healing naturally. Rehabilitative massage is more used in companion with physical therapy in order to get blood flow back into muscles that might have been injured, or to break up scar tissue within those muscles, and to just get the joint or whatever it might be, the mobility back. And then relaxation massage is also a form of Swedish massage, and the goal is to really just let the stress of the body go.
Is there one particular form of massage that you found more beneficial for patients with low back pain?
I have found that, the basic Swedish deep tissue in the lower back, and also used with stretches for the hamstrings and the hips, has been really helpful.
And how do you decide which technique to use? Kneading versus sweeps versus long strokes?
I would have to say, deciding which technique to use, generally we use a combination of all those. It also depends on where the tension is. In this case, the lower back, a lot of the tension in the lower back has to do with the erectors in the lower back, and then also the glute muscles. So it depends on the muscles. The erectors, those you use a lot more frictioning technique, whereas the glutes, because they're denser, you use a lot more like kneading and deeper strokes.
What about if they have low back pain alone versus low back pain and shooting leg pain, that is radicular pain? Do you feel like massage therapy can benefit those types of patients?
Absolutely. Massage is very good for their chronic lower back pain and any residual pain. That being said, I don't think it's the only thing you should try if you've been having nerve pain. I think that there could be an underlying issue that you're not aware of, but in terms of like releasing sciatica pain, which is often the cause of radicular pain, massage can be super helpful in that way, and also it can be a little intense.
For generations, Eastern cultures have believed that massage therapy offers powerful analgesic effects. Studies comparing massage to inactive treatments have found that massage is better in reducing pain intensity and disability for acute and subacute nonspecific low back pain. Massage therapy can also be combined with other non-invasive modalities, such as physical therapy. Low back pain is a disabling condition that can cost patients an average of $6,300 per year. It's ranked 6th out of 291 with regard to overall worldwide burden. It can cause depression, anxiety, and obesity, as well as other chronic illnesses. Patients with multiple comorbidities are up to 53% more likely to receive pharmacologic care, despite the recommended guidelines. This subset of the population is the most heavily medicated as well. Physical therapy is a good solution to the problem. It's a commonly accepted form of managing pain, as well as maintaining or increasing function. Physical therapy not only provides pain relief, but it also encourages patients to engage themselves in their own care. Amber Bloom is here with us to explain our physical therapy options. Physical therapy is often a treatment for low back pain. It modulates pain, it improves function, and it allows patients to better engage in their own care. If a patient comes to you with low back pain, how do you initially assess them?
Well, you have to take their history, how it started, if it was traumatic versus insidious, if it came on just gradually. You have to take into account their past medical history, if there's something systemic going on, or what kind of lifestyle they have. If they're sedentary and they sit at a desk, 16 hours a day, or if they are moving around, if they have a job where they have to lift a lot, you have to take all of those into account.
Have you noticed whether physical therapy is more effective for patients who have low back pain alone versus radicular pain?
I think physical therapy is beneficial for both because there are different exercises, different modalities, different techniques we can use to help to address both.
Talk to us about how you actually perform physical therapy. What is it that you're doing for patients who have low back pain?
Well, what you start with, like I said, the initial assessment, you find out, you try and figure out where it's coming from, whether or not they've seen a doctor first or the doctor has sent us. You decide by what you find out on your evaluation. So let's say, for example, if it were a disc herniation, I would typically start with just seeing what their range of motion is, what their bias is, whether or not they would prefer flexion versus extension. You go from there, give them exercises there. I always send someone home day one with exercises for core strengthening because no matter what happens, if they have back pain, even if they're strong to start with, usually there's a little bit of core instability that happens just as your body's way of protecting itself.
I'm glad you mentioned core. What is the core? What does that consist of?
It consists of all of your muscles basically here and in your back. So, and a lot of studies are showing more that the deep core muscles, like your transverse abdominis, are very, very important in core stability. You need those muscles to help contract to stabilize you when you're going to do a motion like a pushing or a pulling. And if they're not functioning well and they're very weak, that's something that's going to cause you to have more back pain.
And as a physical therapist, if a patient has low back pain, what techniques are you using to strengthen the core?
I usually start right away with just transverse abdominis, trying to contract that. And one of my cues is usually try to hold in your urine and just starting with that. So you're getting the deep core stabilizers first, because everyone always thinks it's my upper abdominals, I need to get those muscles stronger. I call those vanity muscles. They're not as important as the deep core stabilizers.
You mentioned holding your urine. Tell us what that means.
I usually start them out on a table, and I have them put their hands right inside of their hip bones, cough, and then you can feel that those muscles will kind of tighten up a little bit. Then I ask them, try and hold your urine in. You pull in, and those muscles are tight in there. They're trying to help stabilize, because they're the ones that are right above all your perineal muscles that we want to get to work. So it's basically, they have tactile cueing on themselves, so they can feel it.
And how long are they actually holding it in? 5
I usually
seconds,
have them,
10 seconds?
Yeah, I usually have them start 5 seconds, and once they've got a good grasp of it, and I have them do it at home, usually for like 2 minutes a night, that's it. Try and hold it for 5 seconds and relax, set a timer, do that. And then as they progress, I'll give them marches, so they're lying down and they're marching like this, and then we make it harder, put both legs up and tap, and it's just a progression of those muscles, of those exercises to help get those muscles a little bit stronger.
What other modalities do you use in addition to exercises to reduce low back pain?
Ice and heat is usually what we use to start with kind of modulating the pain. You can use e-stim. I also know kinesiotaping, so I like to use that with acute back pain. So those are pretty much where I stick to in my practice anyway.
When I refer patients for physical therapy who have acute low back pain, how many sessions do you recommend?
I would say start with twice a week for 4 weeks, and then see where you're at. It's all specifically patient-based and how they're doing. I like to have a good relationship with the doctor, so if they're not getting better, send them back to you and maybe talk about medically, not necessarily pain, like not opioids or anything like that, but NSAIDs or something like that to try and see if the conservative treatment isn't helping.
Are the techniques different for patients who have acute low back pain versus chronic low back pain?
Yeah, absolutely. For chronic low back pain, I am so focused on core strengthening and back strengthening with that. Acute, you have to bring down the inflammation first, and then you kind of progress more towards the higher level exercises.
How about kinesiotaping?
Kinesiotaping, that is a very interesting type of treatment, but basically the tape has elastic properties, and the more you stretch it, the more it shrinks up, so that it kind of acts as a brace. It works on your proprioceptors, so it helps guide your movements, and it also sticks to the skin and kind of helps pull on it a little bit and stretch out the fascia so that more blood flow can get to the area.
How long do patients leave it on?
You can actually leave it on a couple days. It depends on how their skin reacts to it. It is meant to get wet. So you'll see a lot of athletes in the Olympics wear it. It's sweat proof. You leave it on in the shower. I've had people leave it on for a week.
What kind of benefit have you seen with kinesiotaping in patients who have low back pain?
A lot of people really like it. They said it feels like it's helpful in the fact that it's almost like it's supporting their muscles in the back.
Talk to us now about therapeutic exercise for low back pain.
Well, it's basically like what we just discussed, the core strengthening. You could do, like I said, the transverse abdominis strengthening, getting all the muscles to kind of work a little bit better efficiently. You always want all of your hip muscles, your gluteus medius and your glute max, all of those muscles to work together to stabilize the core. I also will just prescribe stretches if it's necessary, and for radicular pain too, depending on how they tolerate it. If the neural tension isn't too much, I would prescribe nerve glides, which are basically just stretching the nerve a little bit as part of their home exercise program.
How would you persuade primary care doctors to choose physical therapy over opioids as an initial treatment for low back pain?
I mean, you have to have a relationship with them so they trust you. If you know a primary care physician, it's about the relationships, I think, and they want to see results.
What's important for all of us to remember about physical therapy for low back pain?
You should try it, see if it works. If you're not getting the results you want, you let your physical therapist know, and they should be able to adjust your program. And it is absolutely important to be moving when you have back pain, as much as you don't want to because it hurts so much. That's going to make it worse in the long run.
Physical therapy is a time-tested resource for pain relief and spine stabilization. Patients can even benefit from a combination of physical therapy and other methods of non-invasive treatment, such as chiropractic care. The advantages of non-pharmacologic treatment of back pain are clear, and studies have shown that its impact can be significant. We have an opportunity to improve the public health of our country by directing our attention to non-pharmacologic therapies for low back pain and avoiding the non-medical use of prescription opioids. Once we're informed of these guidelines and begin to implement them, we can offer methods of pain relief to patients with low back pain without risking opioid addiction. Let's now explore chiropractic care as a non-pharmacologic option for low back pain. I'd like to introduce Dr. Jeanette Anderson. Dr. Anderson, what is chiropractic care about?
Chiropractic care is a primary portal of entry for helping conditions of the spine. We commonly see patients that are acute for low back and neck pain. Chiropractic care helps neuromuscular conditions of the spine by treating them with chiropractic manipulation, which is manual adjustments or instrument adjusting to take the pressure off the nerves in the spinal column to ease the pain or symptoms.
You mentioned adjustments.
Yes.
I think those entail spinal manipulation, is that right?
Yes.
Talk to us about that. What is that about, and what are you actually achieving when you perform spinal manipulation?
What happens with adjusting is that your nervous system, which is the direct extension of your brain, goes through the 24 freely movable vertebrae of your spinal column. You have in between each of those 24 freely movable vertebrae a disc that acts like a shock absorber and actually adds space for pairs of nerves to communicate with the body. So if there is a problem with the pressure on the nerve, that can be caused by either the vertebrae being on it, a disc that has moved, some of the soft tissue, any of that joint complex, the nerve does not fire the right way. So what happens is that the patient will usually feel some kind of symptom, which is usually pain.
In order to do that, in order to do the spinal manipulation, are you using high velocity, low amplitude thrusts? And
Yes.
what does that really mean?
So a high velocity, low amplitude thrust is what a manual adjusting does by the use of our hands. And so what will happen is we'll move that segment and you move it a little bit past what a normal range of motion would be, so you could put it back in place. You're actually, with that, you might hear a sound. It's not bones cracking. That's another misnomer of what a doctor of chiropractic does, but it's actually an exchange of gas. It's almost like it's called cavitation, and that gas is in between the joint spaces where the discs are. It's almost like when you pop a helium balloon, you hear the pop.
Yeah.
It's the same kind of thing when you move the bone. It's just an exchange of gas, and the thrust that you put down, it's very quick, so that's where the high velocity, low amplitude is. Low amplitude is you're not really moving it that far, it's just the power of the thrust.
Do you feel that chiropractic care can help patients who have acute low back pain as well as patients who have chronic low back pain?
Acute low back pain patients are usually seen multiple times per week for 3 to 4 weeks, and then a reevaluation is done, and at which point there should be a large reduction in symptoms. And also some acute low back pain will also over time improve. Where somebody with chronic low back pain usually can have a comorbidity, prior surgeries, other things going on, history of accidents, manual labor, etc. And those are the kinds of patients that you want to keep going in their lifestyle, right? So they can continue to work. So lifestyle recommendations are usually important for these patients.
Dr. Anderson, is there a certain type of low back pain that benefits the most from chiropractic care?
Yes, there is. It's usually neuromuscular. It's something related directly to the spinal column. It would be inflammation on the nerve itself from either a spasm muscle or a disc, yet something that doesn't involve radiculopathy.
Now here's a question that I think a lot of people are going to want to know. What can you do as a chiropractor to prevent low back pain from occurring?
It's really about lifestyle. It's about learning how to sleep correctly. It's learning how to use your computer with proper ergonomics at your workstation. It's about eating correctly as far as diet. It is about exercise. It is about reducing stress. It is improved emotional health, improved mental health. It's really about how you are as a whole person. So it's not just back exercises, which people always get. And it's not just about simple tips. It's really about how you live your life.
The American College of Physicians strongly suggests the first-line use of non-pharmacologic, non-invasive therapies to reduce pain, stress, increase mobility, and improve quality of life. The more healthcare providers become aware of non-opioid strategies for easing low back pain, the closer we'll come to combating the opioid epidemic. We hope you found these demonstrations both informational and inspirational.